To have you back on the discussion segment on Good Morning Anambra this lovely morning. We are still on the 5th day of May 2025, and what we have this morning to talk about is hand hygiene, saving lives, strengthening public health, and that's commemorating the 2025 World Hand Hygiene Day, May 2025, Monday, exactly today. And the theme is, it might be gloves, it's always hand hygiene. This theme emphasizes the importance of hand hygiene practices and even when gloves are used, and highlights the potential environmental impact of unnecessary glove use. And in the studio, we have Dr. Ru.
Before we introduce our guest, did you wash your hands as you got off your car this morning?
I didn't.
Because that's
I didn't.
They say if you touch your steering, you wash hands. You do this.
Even when you touch your phone too, you need
Even when you touch your phone.
too, you need
okay.
to.
Did you wash?
I did. I can't come into the studio with water, so
Okay.
definitely I didn't do that.
You're welcome. So let's see who has joined us this morning. Two important women that should know exactly how to teach us to wash our hands properly. They are Dr. Rose Amasiane. Dr. Rose Amasiane is a Hygiene Education Officer, Ruwasa, Ministry of Health. Good morning, Dr. Rose.
Good morning, Anambra.
Welcome. And then Mrs. Uju Adendo. Mrs. Uju Adendo is Hygiene Officer, Ministry of Health. Welcome, Uju.
Good morning, all.
Good morning.
Good
Welcome.
morning, Anambra.
Yes. You heard me when I was asking my colleague, did you wash your hand as you got off your steering? So how do we start teaching adults again how to wash hands? Yes, Dr. Rose.
Hand washing is very, very important. Hand hygiene. Now we have hand hygiene day and global hand washing day. Hand hygiene is a do-it-yourself practice, which is safe, cheap, and life-saving. It's everyone's business. If you neglect hand washing, the transmission of disease will be on the high side, because hand is always the culprit of disease transmission. That's what we call the oral route of disease transmission, which hands is one of the culprits. You touch maybe an infectious object or surroundings. If you don't wash your hands, the person can transmit infectious diseases, especially the enteric pathogens, into the system, which will cause health challenges to the individual. So that is why it is very important to wash our hands to avert disease transmission, especially in the health sector and in every aspect of life. Whenever we touch an object which we think that even if this on surface now, if we do scrub now, you can see that we have many microbes, which some of them might be infectious, because microorganisms are ubiquitous, meaning that they're everywhere. It can contract the infectious one or the pathogenic one, maybe by touching a surface or by assessing a patient. In the healthcare system, sectors, hand washing is very, very important. Like the team said, it might be gloves. It's also always hand hygiene. You know that gloves, if you before you assess a patient, you must wash your hands. In as much as you wear gloves, if you cannot use one glove to assess one patient and use the same glove to assess the other person, because it can transmit disease. Healthcare worker can transmit disease from one patient to the other. Gloves is good, but it's always hand hygiene, so that you cannot, disease transmission will be reduced to barest minimum. So hand hygiene is very important, and everyone should learn how to wash hands effectively.
Okay, we'll still come back to the gloves issue. Yeah.
Talking about hand hygiene and the rest of it, we're making that our hands is, like there are germs that are permanent on these hands, that no matter how much you wash, there will still be something that is there on your hand. So does it mean that by washing, we are eliminating these germs totally, and then science will still tell us that you don't even need to eliminate all germs in your body. you need healthy germs to still be healthy. Sometimes this thing is really, really confusing. You hear this and you hear that, you begin to wonder, with all these things. So please, can you clarify us on that, talking about Uju Adindo, please?
Good morning once again. Talking about germs in our hands.
Yeah.
You know, hand washing is the most important thing in hygiene, personal hand and personal hygiene. So, even though there's germs in our hands, we need to use soap and water. Soap under running water. We wash it. We have hygiene practices of washing of hands. You wash your hand properly to avoid germs because of the oral route transmission. It comes from hand to mouth. So in order to wash our hands properly, we have hygiene practices, ways, the important ways of washing our hands. You first of all wash our hands under running water. Then secondary, you apply soap. We must use soap. In a way where there is no soap, in areas where there is no soap, you can use ash. You can apply ash. Then you apply ash or soap where soap is available. Then we scrub our hands. We scrub our hands. There's many ways you can scrub your hands very well. You scrub in between hands, in between fingers, like this. You wash the undernails. You wash your undernails on top of the hand surface. You wash through the elbow side because of some of us that do eat ladies' food, that is okra soup. You know okra soup do draw. Once you are eating it, it might be drawing. So in order not to contaminate contact infection, you wash through your elbow. Then after scrubbing all the most important areas, then you rinse. You rinse. After rinsing, you dry your hand as if you are singing "Twinkle, Twinkle, Little Star, How I Wonder." You dry your hand, or you can dry like 5 seconds.
No need of using towel?
You can use if you
napkin?
have. No, if you have a clean towel or napkin, you can use that.
Okay.
You can use a clean.
Now, what I was saying is that we've heard about good germs and bad germs, but when you wash your hands thoroughly like this, you're talking about, don't you think you eliminate the good germs that they say that does keep us somewhat healthy? That's the question I was asking.
Okay, I think a doctor will take that question, and let's actually find out, is there any germs that keeps you healthy that you don't even need to wash off your hands?
Yes, you know God is a special being. That's what we call the normal body flora, which God kept in our system to protect our system from incoming germs. Those ones are the one God made to be in the human body. But when another one that is an intruder comes in, you can call it they come to invade they can, if you don't take time, they will eliminate the normal body flora God put in our system.
So they're invaders.
Yes, they're invaders. The pathogenic one, those one God kept in our system to protect us, they are not pathogenic, they are normal body flora. Even if we do hand scrub and you plate it, you will still see some organisms. But when you check it, you see that they are not the recalcitrant strain, they are not the harmful one. It's there to protect our system. Do you understand? Even in different part of the system, like in the woman body, God kept a normal body flora there. Like this Candida albicans, there's from there, God kept in that place to protect the
Candidas?
Yes, there are the ones that are not pathogenic. But
what do you mean when it gets pathogenic? When it starts squashing you?
It's the one that causes harm to the system. Let's assume an intruder now come. The recalcitrant strain, the pathogenic ones can come and remove the one God kept there, the normal body flora. And once it's steady, it will not erode the normal body flora, the normal bacteria.
So that's the kind of candida that will be in your body and it will be squashing.
They are not parasitic. They are not itching. They are not itching. They understand. It's the one God kept to protect that place.
Okay.
But when the recalcitrant strain or the troublesome one comes, it will not try to erode the normal one God kept. That is why people can start having thrush and all the rest of them. You know, every part of our system, God kept the normal body flora. Do you understand? That will protect the system. But hand washing, if washing our hands does not have any effect on that one. But what we are trying to say is the one that we can contract that are harmful. That if we don't take time, if we don't do effective hand washing, we will now contaminate ourselves.
Okay, by the time you wash by the way that Uju said, you wash your nails, you wash the back of your palm, you wash the front, wash in between and all the places. Will the flora will still be there?
It will be there.
We wash with ashes and soap,
it will be there.
wash off and then rinse again and it will still be there?
It will still be there.
Oh, really?
Like,
I've heard that before. So I've heard about happy gems. That's what they call it. Happy gems.
Because God made it to be there. That is why we will not allow the castrant one, the pathogenic ones to invade our system, to remove that normal body flora God kept in our system to protect us.
Okay. So how do we, when do we feel that's need for us to wash hands now? Like you heard what I asked AJ, you just, turn your steering is supposed to wash and the whole lot of things. Do you just keep washing? You do anything, you wash your hand and whatever.
We have a critical time to wash hands.
Yes, tell us.
In WHO, the healthcare system, they call it critical moments to wash hand. We have 5 critical moments to wash hand in the healthcare system. One is before you assess a patient, you must wash your hand. Before you do aseptic procedures. Do you understand?
That's for hospitals.
That's what I'm coming. I say in healthcare system.
Okay.
I will still talk because hand washing is everyone's business.
Okay.
No matter in any sector you are, hand washing is very important. Talking about the healthcare system now, you must, before you assess a patient, you must wash your hands. Before you do aseptic procedures, that is maybe you might do surgery, you might do in hand. In as much as you wear gloves, you must wash your hands. When you touch the patient's surfaces, because you don't know the patient that came with infectious diseases that can contract. That's why many health workers have a opportunity, operational hazards. Because you don't know, it's when you do assessment, do you ask, this patient has an infectious disease. That is why from onset, you must protect yourself. That's what we call infection prevention and control measures, which you take as a health worker to protect yourself. You protect yourself from contracting any infection from the patient and also protect your patient from you transmitting any infection to the patient. So the patient will not come to the hospital and carry a disease that the patient did not come with. That is why you must be extra careful. So you must wash your hands before you assess a patient. You must wash your hands when you do aseptic procedures. You wash your hands when you touch a soiled surfaces that you think that might have an infectious organism. When you touch a patient's fluid, body fluid, you must wash your hands. And when you touch the patient's surroundings, you must wash your hands. And after everything, assessing the patient, you must also wash your hands to protect yourself and also other health workers and also the patient. Then in other aspects of life,
in our homes,
after you must have come out from the lavatory, that is from the toilet, you must wash your hand. Anything that concerns shit must end there. Because this is shit. Many microbes lives in shit. That if you don't do effective hand washing after going to the toilet, you will transmit disease to yourself. The thing that God rejected might come back to your system again, because like some people that say they wash with hands. Do you understand?
And that's where I'm going now. Are you going to wash your hand before you go to the toilet? Because you would, some people use toilet tissue, some use water to wash their body.
The important one is after coming out from the toilet, after using the toilet, you wash your hands with clean water. That hand washing facility must be inside the place that they use in the toilet facility.
No, if you're using your hand to wash, if you're not using toilet tissue, you're using your hand to wash, the hand needs to be clean too, to wash that place.
After using your hands to wash, particles of fecal material, you might not see it. And it can contain millions of microbacteria, fungi, and viruses. That is why you must wash your hands.
So is it even hygienical to wash your hands, to use water?
People, because of present dispensation of the country, tissue is very costly
So
now.
what do you advise?
To me, I don't use water. I use tissue, and I must do effective hand washing. There must be hand washing facility inside the toilet before you touch the door handle. Do you understand? And you must do this when you are washing that your hand. You must consider the critical areas to wash. Like she said it, you must wet your hand first, touch soap, and wash the palms, the nails, the interlock of the hands, the thumb, because many people normally forget this thumb, back of your hands, and also you rinse. After rinsing, you air dry. It's not necessary, it's not good to use towel, because that towel might contain microbe. You use maybe tissue, this safe serviette to clean your hands, or you air dry. Then after you must have touched animals, you must wash your hands. If you go out, maybe you went to the market, when you come back you must wash your hands. If you touch a surface, like this surface now, you must wash your hands before you use that hand and put something inside your mouth. Those are the critical times and critical moments to wash hands outside the health system, in your homes, in office places. You wash your hands, but we're always in a hurry to just, it might take us hours to prepare our food. But 20 seconds to wash and do effective hand wash is always very hard for us.
Some will just put hand in the
Just
water
about like
and
this.
start eating.
That is why in the home, if there's any maybe infection, all this that can cause diarrhea. Because in the household, they normally bring water in a bowl. Daddy will do hand like this. All these places are not washed. The mommy will do all
the same water.
So the same, and they will use it in one food. Before you know it, diarrhea will come in, or typhoid fever, all these synthetic diseases. You understand? Because if maybe one person had that organism, one point infection, the person now transmitted it to the whole household. That is why effective hand washing is very important. Then we must use soap or ash, because some people tell you don't have money to buy soap. Ash is not costly. You understand? So
yeah, you said a whole lot, and I'm beginning to wonder what could be the solution. When you're talking about food, for me personally, I can manage that. But what happens to food vendors? Those people that are selling food, those people that are serving the public, do they actually go through these rigors to wash their hands before they now serve the public?
Or even prepare it.
Or prepare it. Or do I need to like go to places where I patronize food vendors and make sure that they follow this hand washing hygiene to be sure, so that I will know what I'm eating? Now, coming to think about this, hand washing, today is hand washing day, and we don't want to negate the importance of hand washing, but one needs to be alive in order to actually wash your hands. So now the question is, while you're propagating hand washing, will you be in the area of wanting to eat food? Do you do the same with cutleries too? Because definitely everything that you pick food and put in your mouth should definitely, your cutlery can contaminate what you're eating too. Am I correct?
yes,
But
that is why this sensitization.
yeah.
Because every day we have hand hygiene day, which is today. We have global hand washing day, which is 15th of October. Yes.
Oh, what's the difference?
The difference, like this one, is mostly saying something about the healthcare system.
And the other one?
The other one is globally, that's schools, everybody's business.
Oh.
Because if you just check the thing, it might be gloves.
Yeah,
It's
and
always-
gloves is used in the
Always,
health sector.
yes,
Okay.
Do you understand? If you check what the WHO and CDC gave us for this thing, so they are pushing the whole thing directly into the healthcare system. It is still everyone's business. Anything you learn today will also help you to take care of your life. As you're saying,
Yeah.
if you cannot use a dirty fake to eat in the restaurant. That is why we all here now are ambassadors of hand hygiene. Do you understand? We have to cascade, like you that is patronizing food vendors. Anytime you enter there, it's a time for you to sensitize them, to mentor them, look at the right thing to do. You check whether the person wash hand before they share that food to you. And the type of cutlery they gave to you, is it washed? You can request for water for you to wash your system, for you to wash it. If you really want to enjoy your meal, like me, I normally enjoy an apple with hands. Because I don't know that's what God kept in. That if I use faith to swallow, I doesn't get the test. You must request for water to wash your hands. If they don't have hand washing stations there, you have to mentor them. They're supposed to keep it. Because it's always what we do. Anytime we do monitoring. In any place they serve food, you must have hand washing station. There will be soap, there must be soap. And running water. If they don't have it, then in that place you are now, you tell them to bring water. At least if somebody is pouring water on you, you still washing water, washing your hands under running water. Not washing it in a bowl. You rub the whole germs on your hands, you take it back. So you must wash off the microorganism, the dirt on your hands before you eat. And after eating, you must also wash your hands effectively, considering the critical areas.
Okay. So, would you, if I come to the hospital and discover that the health practitioner there did not do the necessary hand hygiene before touching me, what do I do?
That's why we are doing all these things today. We sensitize. Anytime we see ourselves in the hospital, we sensitize them in case of if they are not doing it right, we'll put them right. We'll tell them they need to sensitize, or they need to change their gloves. It's not after using one glove to attend to a patient, you use it to another patient. You need to discard each gloves. Once you use a glove on a patient, once you are done with it, you discard. Then use another one on another patient. Doing this will help to cut.
Do you discard and wash your hands before you wear another glove?
Yes.
Okay.
You wash. Yes. You wash your hand. Okay. You wash your hand in the sense that you might there might be germs in that the other glove. That's important to wash your hands before you wear a new glove and treat another patient. Thank you.
Okay, thank you very much. Yeah, Doc, let's now look at the theme of this year's celebration, which says, it might be gloves, it's always hand hygiene. This theme emphasizes the importance of hand hygiene practices, even when gloves are used, and highlights the potential environmental impact of unnecessary glove use. Let's get to this glove something, like Uju pointed out. If you get to some hospitals, especially private hospitals, you discover that they sterilize these gloves. They use the gloves, put it in a bucket, use it, pick, put, and just like that. Perhaps after that, they wash it, spread it, and then they still use it on people.
No, I don't notice. I don't think I've come across any.
You've not gone to hospitals in rural areas.
No, the glove is not supposed to be reusable.
It's supposed to be disposable.
Once you use it. That is why they normally give them parts. And you say private hospitals, but I've not noticed that. You might, once you collect a glove, after using it on a patient, you discard. Some might not have time to, because maybe you have many patients. If there must be hand sanitizer, the doctor can use hand sanitizer to do hand rub and do another glove. Do you understand?
Okay.
At the end of all the procedures, because if you tell a doctor now, after using this glove, you go and wash your hands, which is the normal thing they're supposed to do. They will tell you they don't have that time. Once you do, you can do hand rub with a hand sanitizer, then wear another glove. At the end of all the assessments, you wash your hand to protect himself and the other patient. It's very, very bad to use one glove on one patient and use it to another patient. Because that patient, you have not done any assay. You have not done any microbial analysis to know whether the patient has a highly infectious organism. If you use that one, you can use it to transmit to a patient. I've said it before.
What about
the other patient?
Even when you sterilize it?
Sterilized glove. You can use sterilized glove, which is even rubber.
It's disposable.
They'll put it in water and pour.
No. It's disposable.
I've not.
You dispose.
I've not.
It's
Unless it's this thick glove, they normally this cleaner normally use.
No, it's not that one. It's the one that they use and then touch people. Okay, but that's fine.
It's not an ideal thing.
That's just
it's very bad practice.
That's why we're talking about it. They do these
why
things to save cost. Okay, but I don't know how much that glove is costing
you are
the
not
market.
treating a patient.
You are not saving lives.
Yeah, it's not costly.
That one is you are now predisposing your patient to more
germs.
Please, it's not. These gloves are not used. Once it's used, it will be discarded. So I'm hearing this one for the first time.
Okay.
Yes.
So apart from that, what other things do you need gloves for in a hospital apart from examining your patients?
You need gloves. Maybe if you want to assess the patient's surroundings, gloves should be used. Like cleaners, they have gloves. You have to wear gloves to even patients in beddings and all the rest of them. Because the patient might come with, as I've said, the infectious organism. The gloves is very important to use. Do you understand? And after using it, it must be disposed in a very safe way. You dispose it in a safe way.
How do you dispose it?
That is what the effective and safe disposal. You can't just fly it anyhow because you might have a small, maybe a child. The child can pick it and put in their mouth. So it
like some big condoms. Okay, let's how is it? How properly are you supposed to dispose it? You dig ground and put it in a pit toilet, or how do you dispose? Or you burn it?
You know, that is why they say environmental impact. Of course. Glove is not biodegradable.
Yes.
That is, microorganisms cannot decompose it. That is why they normally put it in an incinerator and burn it. Do you understand? Some that doesn't have incinerator, they have a place, maybe a pit they dug, where they'll be disposing all this and it will be burnt. And when it is glove is being burned, people have to come and go away from that place because some microorganisms during that burning might move in the air and the person will inhale it. Do you understand? So when disposing it, when burning it, you must consider the impact. In health impact, that is why they say the health impact of it, of that gloves. So I think in a health this thing that we can do without it, it will be better to do effective hand washing because that glove has an environmental impact. When they dispose it in non hygienic way, small children can pick it. It's not biodegradable. It can pollute. The aesthetic condition of our environment will not be destroyed. Do you understand? So that is why the gloves has to be disposed in a safe, hygienic way. And when it is being burned, you burn it in a place that is away from.
Isolated.
Yes.
Now, talking about hand hygiene and the rest of it all. When you walk around, you see young men, scavengers in refuse dump, scavenging for plastics and the rest of it all with their bare hands. Even the ones that are government workers coming to pick refuse, hardly do you see them use gloves, you understand, to protect their hand. And they touch all manner of things. And some of these people have children at home. Some of them go to places where they meet people. How do you carry your sensitization to those areas? Because these are the actual...
enter public buses, but public transport and rub those hands.
You understand? So this is... Thank God we're no longer in the era of COVID and all these airborne and communicable diseases.
COVID is still around.
A lot of people would have been endangered with such acts. How do you carry your sensitization to those people in order for them to either look for gloves to use or even desist from those kind of crude way of scavenging?
We normally do community sensitization about water sanitation and hygiene. And this hand hygiene is one of the personal hygiene, which the only thing our people ignorance. When you are telling them something, they will tell you that the disease doesn't kill Africa. Like those people you are talking about cannot pass without stopping, and also educate them.
On the dangers of what they are doing.
The dangers of what they are doing. The way they are doing it is even highly irritating. But because they don't know what they are doing to themselves. And they might come to such people's household, they see maybe one or two diseases might be, they don't even know that it's somebody that contracted that and brought it back home. Do you understand? They'll be spending money. Even some of them might even have all these skin infections,
Scabies.
fungi, scabies, and all the rest of it because of the way they touch fields. Do you understand? So we need continuous sensitization. We have been doing it. Do you understand? Some of them, like as we are talking now, they are not seeing us. They might be in the field now working. What I normally do, immediately I pass, if I see any of them, I must stop. Someone will greet you. Someone will tell you, madam, this
Mind your business.
Mind your business, do you understand? So it's continuous sensitization until it gets to the last person, because we are told to not leave anybody, no soul behind. Everybody is important as it concerns hygiene, especially hand hygiene.
Okay. So, and when you say it might be gloves, what does that mean?
It might be glue because I'm telling you, the healthcare system, some of them may prefer health workers, they will use gloves. They might not remember that hand hygiene is the cocoa of safety. So you, in as much as you're using that gloves, know that hand hygiene is essential.
Okay.
To protect you, protect your patients and other health workers. Do you understand?
Okay.
Okay, at this point, let's call for street walk and then get to feel the pulse of our street parliamentarians. Let them know the part and contribute to the discussion we're having. Don't go anywhere. The show continues after this.
The benefits of washing our hands is simple. It helps to kill germs in our hands, because as we go out every day, anywhere you go, you have contact in different places. So in having those contacts, it is necessary that before ever you put anything in your mouth, there is need for you to wash your hand so that you cannot contact most of these diseases by maybe insects like flies, having contacts with people, shaking of hands and all that. And so when you wash your hand, those bacteria, I believe, will be out.
Primary thing is personal hygiene. Washing your hands, even if before I stepped out of my house, I washed my hand. But having a handshake with someone can leave some, iota of bacteria on your hands. The air is polluted already. These are gases, coming out of the car. So having, an impact on your hand leaves some level of bacteria. So you see someone now will just, I washed my hand in the morning, and then maybe you walk past the road and you shook about 10 people, and then you want to eat. You don't even use, a proper, maybe let me say soap or something that you just, so those things will have, a drastic or a negative effect in your system. So I think hygiene must start from yourself. Before you take anything to your mouth, you ensure your hand is properly washed and sanitized.
By washing your hands, particularly not just washing your hands, washing your hands with soap and running water. With soap and running water. If you don't have soap around, use ash and running water. Beautiful. By that, you remove microbes, germs that are on your hands, particularly in your fingernails. Particularly in your fingernails. Beautiful. Because as you use your hand to take things into your mouth, these germs go into you. If you do ordinary washing of palms to fulfill obligations, and you do not take care of the fingernails, they are there hidden in the fingernails. Particularly for those who have the habit of sucking the fingers. And sometimes one may suck without really being very conscious of it. And there are germs of which the reproductive cycle are very much synchronized with the eggs, for those ones that lay eggs. You see, so you find that the summarizing thing about the washing of hands is to remove the germs from the hands. So it is very beneficial. And when you do that, you save yourself lots of health challenges and lots of waste of resources, particularly in this era of economic crunch on us.
Uru ọbara mmadụ ịkwọ aka ijecha bata gị ịkwọ aka because of arụ isi ike. ịghọtara because ọ dịrọ mma o nweke na m na-eje kịta na m na-aga n'ụzọ mmadụ ekwe m n'aka o nweke m akwụ ebe ọzọ m hụrụ ihe tinye n'ọnụ mba ọ dịrọ mma because ọ wụ ibute ọrịa ị marụ ihe onye ahụ bu na-agagharị so ọ ya dị mma ebe ọ bụla ijecha abata gị kwụọ aka gị maka ọrịa nje.
Glad to have you back. We are still talking about hand hygiene and 2025 commemoration of Hand Hygiene Washing Day. We're still here talking with Dr. Rose and Ms. Uju Adindu on the issue, on the need for us to sanitize, keep our hands healthy and clean at all times. From what we heard, one of our street parliamentarians talking there, talking about everything you do, make sure that at the end of it all, you wash your hands. Very, very interesting. The more times you wash your hand, the farther away sickness and diseases is going to be from you. But now, talking about this, what of those people that are, what I call it, septic tank cleaners? These are people that delve into sock-away pits with their bare hands, walking in there. What kind of sensitization do you need to do for those people? Because they are not just going in there with their hands, but with their feet, every part of them, all exposed to the billions of microbes in a septic tank. Uju?
Good morning once again. That's why we go into community sensitization. We have been doing this with UNICEF in the years back. So we do continue, and whenever we are passing along the road, we see those people who sensitize, we tell them about what the impact on what they are doing to their lives. It's very, very important to wear gloves and boots in order to achieve what they want. But some of them, because of money and their ignorance, after teaching them all those things, they will just take it as nothing will happen, nothing is happening. But all these things will not show. It might not show that time, but it's at the old age. All these problems, all these germs, all these things, all these microbes will rise up and start to affect the person. So we are still going for sensitization. We are still going for, as in moving around, telling people the importance of hand hygiene. Even though some of them ignorantly do that, they need to wash their hands properly with soap under running water. So it's always good to use water and soap.
Thank you so much. Rose, Dr. Rose, we hear disease, no, they kill black man. That's why you see people abuse personal hygiene, what is it called, hand sanitization and the rest of it all. The annoying thing is that if you do this thing on your own, no problem, but you still see these people mingle with the society, everybody in the society. Somebody that you don't even know what he's doing will go to the market, wants to buy meat. He will touch the meat, flip it over. And at the end of it, he doesn't buy the meat.
Meat that you are going to cook.
You know.
What about corn that you pick from that fire and eat?
So how do we go about creating awareness so that people, because now you want to buy something and somebody has already touched it and the person is not buying it, the thing is there. It will discourage you from wanting to pick that thing and eat. So what manner of sensitization do we need to do? Or should there even be a law to go against this? Because this is health we're talking about here.
Continuous sensitization is is the key. And one-on-one sensitization, when you see such a thing, you have to talk to those people. And the ones you see such, the person has made like corn now, when they are frying corn, roasting corn. Somebody will just touch and keep. And it's something you eat, you will not cook it again. The person can have an infectious pathogen on the person's hand, and another person will not contract it. That is why you yourself have to play safe. Once you see such a thing, you have to talk to that person immediately, and also make sure you don't take that one. And also, you need you are talking about the government has to come in and bring out because sensitization they cannot do it without money. All these things needs money. Do you understand? We have been there are like when UNICEF was with us, they partner in 4 states, 4 local governments. But the government always bring money, which we do replicate what UNICEF has done in those local governments. UNICEF was partnering with Agua at Anambra East, Demili South, and Inewi North. Government also bring their own counterpart funding. Then we now cascade what we have done in other local government, in the local government that they are not sponsoring. Do you understand? Because Anambra people, all the 21 LGA, the citizens need all those sensitization, but it needs money.
It needs money. I was actually going to ask you the challenges you guys are facing in the Ministry of Health when it comes to institutionalizing hand washing or personal hygiene in the society.
Like we normally go to sensitization, train teachers in schools, because we have to normally catch children young. When you catch children young, agent of change, they will be agent of change. Because whatever you teach your child when they are young, they will grow with it. So we normally focus on primary schools, secondary schools, where we train health teachers. We call it school sanitation and hygiene education, where we now have an environmental health club in schools that will be hygiene champions, ambassadors of hygiene, and sanitation, wash hygiene ambassadors that will carry this one. There was one scenario, one child, that was in Agota, isn't it Agota to be precise. The boy came back to school because they have mentored them through the environmental health club that after going to the toilet, you must wash your hand before you touch anything somebody will eat. That day the guy came back home, the mother dished out food, the palatable jollof rice. The boy refused to eat. The mother beat him. He suffered to prepare this food. He said he will not eat. Until he now tell the mother, my teacher said, if you come out from the toilet, you must wash your hand. The mother now kept that food and washed his hand, dished the food again. The child now ate. The following morning, the teacher now carried the child.
Okay, the mother came out from the toilet and went and dished food for him.
Yes, without washing.
Okay,
so
now we
teacher
understand.
has said, that is why anything, teacher, when we are small.
It's still prevalent.
Yes,
Children still do it. My auntie said.
You understand? The one you are telling them at home is
that one no follow.
That is why you must go. We are going down to this thing to catch the young ones, so that we have a healthier children that will bring a healthier generation. Do you understand?
Very
all
important.
these things need money. Even in
So
healthcare system,
also
we
how-
also need sensitization to health workers, because some of them also some might fall, not all of them might not remembering this hand hygiene all the time. And you know the health sector is a place that the disease can transmit at random. So they must maintain this hand hygiene for infection prevention and control of disease spread. Very, very key, in as much as we use glove.
Okay. We use glove, what is in the health sector, and we use our hands every other place. We are rounding off. Uju, so what's your advice to our people?
My advice to our people all over the world and Anambra is that hand hygiene is the key, is the cocoa. Everybody must practice hand hygiene as personal hygiene. Under running water. If you don't have soap, try and have ash. Ash.
That ash
It's even more difficult to get.
is difficult to get.
Can't buy firewood now. Firewood is very expensive. Okay, for those in the village, yes.
Those in urban areas can afford soap.
And those
We
in
have
the village,
soap of,
anything can be
1
firewood
feet.
for you in the village.
Yes.
Yeah.
So we use soap or ash under running water.
Okay.
And make sure to scrub your hands under your nails, under nails. You know, some people that are using, when UNICEF taught us about using water to wash our bumbo after visiting the toilet. So one day I visited one community. So because we taught them about using water to wash after defecation. So that man is he has long nails. So after washing, after defecation, so
I'm ready for this.
Those entered the nails, that long nails. So when we went there, as we are telling them about it, he said he's practicing it. So when I asked him to show me the nails, we saw some germs, some particles underneath the nails. So that's why we tell them the need to cut our nails. Even though you are using running water, you are using soap, there is another, you can still contaminate infection because of your long nails. So we need to cut our nails. We cut it. What is the money? Very low.
I don't know. I don't know what that man was keeping nails for. Yes.
For a girl, it's fashion, but for a man, what?
Fashion.
But if you can, for a girl, if you can afford to fix nails, you can also afford to buy tissue and use on yourself instead of washing your bum bum with water. You know, it's irritating, but it's okay. It's part of hygiene. If you can do it very well. Make sure there's no nails on your fingers, and then wash properly. And after washing your bum bum, still wash your hand, wash your nails, wash everywhere. That's what we're saying today. We are going, Dr. Rose, please, advise our people.
My advice to our people is hand hygiene. It's safe, cheap, life-saving, and it's everything that will protect us from transmitting of disease into our mouth. Even also in our transmitting disease in our body, because they can contract an infectious, maybe a fungi, or these dermatophytes. If you don't wash your hand very well, you can introduce it on your body. So hand hygiene is very key. And I'm advising our people, since I've said before, hand hygiene is everybody's business, whether in office or in at home or in the market or in the health facilities. Being a health worker, a patient, hand hygiene is very key. And all of us supposed to be an ambassador of hand hygiene. Okay. So that once we are propagating it, if I do my own now, you do your own, and everybody is doing your own, before you know it, everybody will
the message will go around.
You understand? So let us call hand hygiene. Let us take it as an important thing. And it doesn't take much time. Highest 20 seconds, you are done with it. And you have to consider the critical areas and know the critical times to wash hand in no matter where you're, even if in office, in health sector. I've already said it before. 5 moments of hand hygiene in health sector. In every other place, like offices or at home, after going to the toilet, you wash your hand. Before you feed a baby, wash your hand. Before you prepare food, you wash your hand. After eating, you must wash your hand. If you touch an animal, you must wash your hand. If you touch a dirty surface, you wash your hands.
Even before you breastfeed.
Even before you wash your hands.
Wash your breast.
So that you not transmit disease to a child that the immune system has not yet developed. At times you see mother, they are complaining that they are baby. Someone will tell you the child is teething. That is why the child is purging. Teething does not purge a child. It's the germs, the baby has soft germs. Either while you're preparing the baby food, or when you maybe didn't wash your hand very well, or maybe your body is very dirty, the person can suck this the child will start.
We'll bring you back.
Thank you.
Thank you very much. Yeah,
thank you. That's the much we can take. Thank you so much. I've really learned a whole lot. And I believe that wherever you are hearing us, you definitely know the needful thing to do in order to keep yourself in tune with your body hygiene, especially your hands, because this is the transporter of everything that we do that goes to the mouth, the ear, and the other parts of the body. I want to use this opportunity to thank Dr. Rose Amasiani, Hygiene Education Officer, Ruwasa Ministry of Health. Thank you so much, Dr. Rose. And also Mrs. Uju Adindu, Hygiene Officer, Ministry of Health. Thank you so much for being here.
Very much.
We
Thank
really
you.
appreciate.
Glad being with you.
Yeah.
All right. Thank you. Thank you very much.
And that's the size of our package this morning. Up next is Sport Splash coming up. Don't go anywhere. Good morning, Anambra still continues.